So it's time to welcome our second keynote speaker for the day, and this is Professor Donald Colliver. Colliver is an emeritus. He's an emeritus professor in Biosystems Engineering Department at the University of Kentucky. He holds a PhD from Purdue University, and he is a licensed professional engineer in Commonwealth of Kentucky. So, Donald, the floor is yours.
Let's try it now. Great. Thank you. And thank you for the floor tonight. Hopefully I can remain on the floor and not on the side. For those of you who have not spoken up here, there's a gap about like this between the back of the stage. And when I was speaking the other day, I was pointing to the screen, and the next thing I knew, I was laying on the floor. So anyway, thank you for being here. I was actually think I was going to be the third speaker, but so that gives me more time, right? Yeah. Oh, it does? Oh, great, thank you. I can ask questions. This is part of me. Oh, actually, so I'm a retired soccer referee. And I do have my cards that I was going to give to him earlier, and he said he already had it. So anyway, it is great to be with you this morning. Oops. Without advancing. Screen is shrunk as well. Anyway, as we're going through this queer lounge process, he always knows what's going on, right? Officially translator. Also earlier this morning, this was working. Okay, we'll find. So what I'm looking at today is really the nexus of climate change, healthcare, and then a term that you may or may not be familiar with, and that's the analogy of buildings being humans' exoskeleton. And we'll get into that in a minute. Okay, we're fine. Okay, so as we look at this, the challenges that we have of climate, that is impacting people's health. It's also going to impact the design of buildings. And so what I'm looking at is what are some of the similarities between the healthcare and humans and buildings. And really what I was hoping from this conference is that what we would be able to do is have the healthcare professionals and the building professionals work together to say, are there similarities between how we do diagnostics, how we do treatment of the various illnesses, and there are illnesses, and we'll get into that in a moment, illnesses of both systems. So we're having a changing climate, and how does that impact us as well? So this is a history of the global climate change, and what we're seeing is the history of the temperature from the last 2,000 years. Just use the pointer. Okay, good deal. Thank you. So what we're seeing is anyway, what we're doing is we are looking at the climate, the temperature over the last 2,000 years, and what is in gray is the black line is the average, but the gray is the variation over the last 2,000 years that's been constructed. And you see the industrial age that started from 1850 to about 2000. from 1850 to the pre-industrial age is where we've normalized everything to zero. And the excursions above zero are the temperature above what the average temperatures were during that time frame of 50. Thank you. From 1850 here is normalized to zero, so these are the excursions, are the temperatures during that time. But you see here from 1850 to 2020, how all of a sudden we have had a vast increase in the temperature in the last 70 years, okay? Now, you say, okay, that's 2,000 years. So let's look at the previous 100,000 years. And that's this bar over here on the left, from 0.2 to 1. And what we're seeing here is that the temperatures in today's climate is greater than it has been in the last 200,000 years. Astonishing, right? So what's happening? And let's expand that 1850 to 2025. And this again is normalized to the pre-industrial age. And we'll see that there's an overall trend, but not only is there an overall trend, you see that there are some excursions above and below. So there is variation. But in 2024, we were about 0.2 of a degree above. Now, all this data over the next few slides here is coming from the European State of Climate Report that was released about when it was released in March. So it's a great document that's quite a few pages that talks about what is the climate in Europe. So we see a great increase. We also see tremendous variations around that. So if we looked at, if we look then from the 1980s to 2025, blue is below zero, and the red is 1 degree above what the average temperature is. What we see is a gradation from going from cooler to warmer. And in January of 25, this was the warmest January of record in 2025 in Europe. Okay? Pretty evident that we're seeing a gradual trend here. So if we look at overall global what is happening, and for those of you in the back, these are the number of days with at least a strong heat stress. The number of days with at least a strong heat stress on the left, and the dark brown is 75 days where we have heat stress for those various climates. A lot of dark brown. On the right-hand side, it's the number of days with at least a long cold stress. And you'll see a lot of days. What we're seeing is a great variation then of temperatures and changes from what the average temperatures are. So, let's go back to Europe. So this is the average temperature from 1955 to 2025. The bottom line is the Arctic, and the second bottom line on the left is Europe. So what we're seeing is that the average warming in Europe is about 0.5 degree C per decade. A great warming trend in Europe. Where is it happening in Europe? There's a lot of variation within Europe. And we see that the northern part of Europe is the fastest warming spot on Earth. And over 30 years, the Arctic has been the fastest warming region. And we see that Eastern Europe has been warming a great deal faster than Western Europe. And the scale here is, the trend is degrees 0 per decade. where the darkest color is 1.5 degrees C warming per decade. So, the question then is we've got all this warming, what do we do about the design of our buildings? So, and I couldn't find this for European, but this is a graphic that is saying, okay, let's take places in America. What is the climate going to be like in 2080? And what we'll find is there's a great shift in what the equivalent climate in 2080 is going to be compared to today. So as we're looking at this in our designs, where should we be designing our buildings for? For what climate? A wide variation. And this is just based upon that. If you're familiar with the climate modeling, you've got all these various scenarios. This is the middle scenario, okay? So this is kind of what our average is. So let's see what has happened historically. So between the handbook, ASHRAE Handbook of Fundamentals has design weather conditions. And based upon those design weather conditions, we have various climates. And you have to design, our code says you have to design a building according to certain climate zones. So what is indicated here is the areas that have changed climate zones between the fundamentals in the last 4 years. The fundamentals 4 years ago as opposed to the new fundamentals. So every place that there is a white cross here or an X, that means that that building had to be designed to a different climate zone. Tremendous changes. And that's just between our last two editions of our handbook of fundamentals. So we've had anomalies and our gradual increasing. But the other component, and this is one that's probably more important to us, is what is happening between extreme events, extreme weather events. And so if we look over the last roughly 40 years, we see back in the 80s, the average time between a $1 billion storm event was in the 90 to 100 days. The average time between a $1 billion storm event is in the order of 10 days now. So not only are we having greater extremes, we're having greater storms and greater storm events. Now this is, the dollars are normalized, so it's CPI adjusted to today's dollars. If we look at Europe, what has happened, these are just an indication of the key events, storm events, that happened in Europe in 2025. Heat waves are the red, wildfires and drought are the yellow, and then we get down into marine in the blue. So why do we have these extreme events? I think the key component here is that what we must remember that every 2 degrees C air can hold 13% more moisture. Warmer air holds more moisture. Warmer air is thirstier, pulls water from the streams and plants and so forth, and it shrinks our water supply. So, given that, if we look at the heat increase in Europe, then additional moisture, so we see that there are more droughts. So these are the drought extreme fire days in Southern Europe, where the darker color is 30 days where we have extreme fire event. And then on the right-hand side, this is the anomalies that we're having in the fire weather index. So, let's look at this then. What are some of the health effects of these climate changes? We've got rising temperatures, we've got these extreme weather events, we have rising sea levels, we've got air pollution. How's that impacting our health? Well, first of all, we have heat-related illnesses. Then we have respiratory effects. We have infectious disease issues. We have water and food security. Those mental types of things that are occurring as well are vulnerable populations of children, older adults, and so forth, and are in particular more impacted. And then we have the mental health effects. Oftentimes we don't think about what is the mental health effects of climate change. We had a flood in our state last year, and the newspaper had a picture of a 95-year-old lady sitting on her bed. But the problem was you couldn't tell it was a bed because it was flooded, and she was sitting in the muddy water, sitting on her bed. 2 weeks later, the news report said that this 95-year-old lady who had always lived in this small community, always lived in her house, this little old lady had passed away. They asked her family, what in the flood caused it? And they said, it wasn't the flood, friends. She died of heartbreak because she lost everything in her life. So we must remember that the health effects are not only our physical components, but the mental components as well. So, moving then to the next section again, is saying, okay, we have climate change, we have health impacts. How does that impact us as humans? And let's look now at saying, okay, the human exoskeleton is really our buildings. Human exoskeleton is really our buildings. And there are a lot of parallels between human systems and building systems. Our plumbing system in our building, similar to our kidneys. Our HVAC system, similar to our lungs. The analogy between our electrical system and our heart, you can draw those parallels. Sewage and drainage, our digestive system. Our structural system, our skeletal system. Our control system, similar to what our nervous system is. So as we look at this, the question is, what kind of analogies and what kind of problems do we have between those types of systems? So, we have illnesses here. Okay, I'm a professor. Okay, I'm going to ask some questions. Questions typically mean that we have some audience participation. Okay? So, I'm going to give you an example of a health issue. And I want you to give me what you think of is what is an example of a problem in a building associated with it. Okay, I'm having an asthmatic attack. What's a building problem? A filter problem. Okay? I'm having a spasm. A seismic event. Seismic restraint. A bleeding, open cut. What's an example of a building type problem? What about a stuck damper? Gotta have those issues. This is one, whoops. This is one that I was trying to draw some parallels to, and I was trying to come up with it. Dementia. What's a parallel problem in buildings that's related to dementia? What about a old pneumatic control system? Okay, a stroke. John, you said earlier. Your BMS system. Let's see. What's another one? A heat stroke. Overheating, okay, but what's a building related? A failed compressor, exactly. A calcium coronary score of 1,000. Basically, that means you've got clogged arteries, okay? Your piping, calcium buildup in your piping system or flow restrictions. So the question is then, as we look at physicians and our medical industry looks at trying to solve those acute illnesses issues, and maybe dementia is not an acute illness issue. What are some of the diagnostics? What are some of the care things that we do in the healthcare industry that we can use those techniques in our building industry and vice versa? Okay? So, when we have extreme weather resilience issues, we've got design decision protocols. When would we shelter in place, or when should we evacuate? Structural resiliency, we've got high winds, hurricanes, and tornadoes. How do we maintain continuous operation in these? And flooded spaces. Should we do our design such that we have sacrificial floors? Parking structures, for instance. Should we put our parking below our building? Delivery of people and goods, shelter-in-place techniques, evacuation techniques. We should also talk about system backups. How big should they be? What about our gas backups? Our production on site, our storage systems, how do we deal with those? Air cleaning. And as we look at what is happening with the fires and so forth, it means that we have tremendous changes that are going to be needed in our air cleaning systems. Water supply, redundant systems, all of these are system backup issues. And fire protection, we typically think of fire protection, what happens if we have a fire in the building, but when we have wildfires that are coming on board, how do we take care of our design of our campus so that we prevent fire spread from the adjacent areas? And then as we look at better and better protection techniques, how do we take advanced warnings into account? So all of these are conditions, considerations that we must talk about when we're talking about extreme weather issues. But just as in medicine we have acute illnesses, we have long-term illnesses in buildings as well. So what are some of our prescriptions that we need for building design? One of the issues here is that we design the structural systems for 50, 60, 120 years. But our systems within our building will change 20 years or so. So if we look at the structural component, well, we're going to have an increasing patient demand as we have climate changes. How do we design the additional spaces for that additional patient demand, and also our population growth, our population changes as we have migration due to climate changes? Floods, sea level. If we have facilities near rivers or sea level, how do we design for that? As we have additional particulates in the air, how do we take care of additional or larger size filter systems? How do we take care of additional chilling capacity? All of those we have to look at. And we all know that our electrical requirements are changing drastically. So our building systems have to change in 8 to 20 years. So long-term climate changes, population, chiller sizes, outdoor air clean, equipment type and flexibility, fresh air makeup. And I forgot who was talking yesterday, talking about the outdoor clean versus the return air. As we have additional particulates in the outdoor air, that outdoor air is no longer fresh air. So we have to talk about that as well.
Don, I think that you can use your yellow card now.
Okay, my yellow card, and so I am 2 slides away. How much ventilation is really needed, and then a water reduction and reuse, and the circular economy. So, other considerations: operation, contingencies, codes and standards. The issue with codes and standards is that they don't change as frequently as our climate is changing. Some of our codes don't change but every 15 years. So let's move forward with that. So, in essence then, the question for this conference is, how can our healthcare professionals and our building professionals learn from each other? So, in summary, folks, climate change is real. Weather extremes are real. It impacts our healthcare and our health systems. Our exoskeleton has similarities between issues related to the body and issues related to our buildings. And we have a number of different issues that need to be addressed, both in the diagnostic and in the preventative medicine practices, both short-term and long-term as well. So, with that, questions, comments, or thoughts?
So thank you, Donald, for your presentation, and I think that Professor Colliver will be very pleased to reply in any question from the floor if there are any. Any questions? In this case, I have one question, Donald. You said that our hospitals have a focused life for about 50, 70 years for the future.
Sure.
What about buildings that were built before 30s and still are in service as hospitals? There are many in others, and those have the problem that also are listed buildings. So any changes?
The real issue is not only the new buildings, the existing buildings is where we really have to be. That's more difficult than the new buildings. If we can't figure this out for new buildings, how are we going to do it for the existing buildings? So I think what you're pointing out is that we have to be able to figure out what to do with our existing buildings, and that is a real issue as well. I'm raising questions. I don't know.
There are studies saying that renewing such a building is perhaps more expensive from rebuilding from the beginning, if possible.
I'm sorry, say that again.
I'm saying that there are studies saying that renewing such a building, an old building, it's more expensive than rebuild a new one from the beginning.
So the question is, if I understand, it's less expensive to build a new building than take care of the old building?
Exactly.
My response is, I agree. But the question is that we have all the embodied energy in the existing building. What do we do when we look at the total carbon analysis, recycling and reuse of buildings? So I don't have an answer to what do we do about taking new buildings, existing buildings, and renovating those. I guess the thought that I've been having is, let's figure out if we can figure out what to do with a new building, and then can we take those types of techniques and equipment and put those into existing buildings. How do we renovate buildings is one of those huge issues that I think is a challenge that is beyond my skills.
So thank you very much for your presentation.